We will get started here. So I am Liz Powell. I'm the founder of Women's Health Advocates and G2G Consulting. And today I'm wearing my brand new Women's Health Advocates shirt. I'm very excited. And on the back, it says, I don't know if you can see it, but what's your why for our What's Your Why campaign. So you can get this shirt by coming to an event. So hopefully that incentivizes you to come to an event. We are not selling them online or anywhere else except for events for now. So today I'm going to go over some slides, give you some updates. Thank you. I saw that. I love it. Thank you. And making sure, do the slides look, oh wait, I have to put it in slideshow mode. Do the slides look good? Is it in the right mode? Someone tell me.
Yes.
It's in the right mode. Okay, awesome. All right, so let's go through some updates. All right, so we are going to cover updates on what's happening in DC, what's happening with Women's Health Advocates, upcoming events, advocacy actions, things that you can do. So with DC updates, we're going to start off with what is going on with the FY 2026 appropriations. And right before the recess, like literally the last day, the Senate came out with their bill, which we did a great summary of for folks. So you could see all the exciting language references around women's health, funding lines that were really very positive. The House just marked up their bill. And so I'm going to have my esteemed colleague, Dr. Aditya Girish, hop on and share some updates since he's more on top of it today. So with that, I would pass to you.
Thanks, everyone. Yeah, so as Liz alluded to, just yesterday on Tuesday, Congress came back into session and the House Appropriate Committee made some progress on marking up the FY 2026 Labor, Health, and Human Services Appropriations Bill. So the text of the bill was just released yesterday or day before yesterday, and there's still some readouts that we're waiting on, but I can share some top lines. So it basically funds the Department of Health and Human Services, gives it discretionary spending of $108 billion. So this represents a 6% cut relative to financial year 2025. I will say, for context, this is significantly higher or significantly fewer cuts than what was proposed in the Trump budget proposal back in May and June. That proposal had proposed a level of discretionary spending of 94.7 billion for HHS. So it's significantly more spending than what the president had proposed. It is, however, slightly lower than what the Senate had put out back in July, which was at 116 billion. And so we anticipate that, if the usual negotiation happens between the two chambers, the final number will be somewhere in between that 108 billion and 116 billion. So going into some more granular detail on what's in the House bill. So there are some cuts to NIH, but overall, it's close to level funding. So it funds NIH at $48 billion. So again, that rejects the Trump budget proposal of slashing NIH funding down to 28 billion. So definitely a positive for anyone who is a big supporter of NIH. As far as I can tell, and again, some readouts are still pending. There does not seem to be that wholesale reorganization of NIH into just 8 institutes and centers, as far as I can tell. So I think a lot of those centers and institutes are still being funded, even if that funding is slightly reduced here and there. So in terms of other salient points, it provides 100 million for the Make America Healthy Again initiative. Again, details are pending, but again, that's focused on tackling things related to chronic disease. And again, it's lower than what the Trump administration proposed at 500 million. Aside from that, the biggest casualty, unfortunately, is in terms of funding reductions is CDC. It reduces funding by about 19%. And again, specific details are pending. The Secretary of Health and Human Services will be testifying before the Senate committee tomorrow. So hopefully we'll get some more details on that. Additionally, some other major points, it appears to eliminate, at least in this bill, the House bill, eliminates the Agency for Healthcare Research and Quality, AHRQ. But again, details are still pending. On specific language related to women's health, again, very limited. It just reaffirms support for the Hyde Amendment. Again, that prohibits federal funding for abortion-related services. Um, and that appears to be the most explicit connection. Um, we are waiting on the report, which will actually put together, specific directives on how they'd like specific funding lines to be directed towards women's health research. I will also say that they did make a call out to the Office of Research on Women's Health, so that is still there. Indicate that the Office of the Director's funding can still be used to support ORWH. And then lastly, of interest to this group, ARPA-H, it has been funded at a reduced level of about 945 million, so less than what the Senate had put together, but still there. So yeah, that is all I have at this point. Happy to answer any questions, or Liz, if you want to keep going, happy to do that as well.
This is Vanessa here. We do have a question in the chat right now that says, how does discretionary spending work? Is it highly directed by HHS, and with things that have already been cut at the NIH, etc.? Where is the money going? For the CDC, so many people have left the CDC and there are so many changes made. Where is the money going to go when it is only a 19% cut?
Okay, that gets into a really long answer. So just discretionary money just means that the agency controls where the funds go, whereas entitlement, it's not included in the annual appropriations process. So that's how we distinguish the terminology discretionary versus entitlement spending. But I just want to keep moving through here. We can do questions at the end. Thank you so much, Aditya. We've got two things coming up. CMS reimbursement. We are working on a letter, and it's in our online advocacy tool, working to educate and fight for parity when it comes to CMS reimbursement in gynecological, urogynecological procedures, as well as products and innovations. But right now we're doing a big push because they've got the physician fee schedule that came out in a proposed rule, and they are accepting comments until September 12th. So we have a sample letter for you. If you are a doctor or a clinician of any kind, it's really, really valuable and important that you submit. Also, doesn't matter if you're a doctor or patient, this still obviously impacts us. So please check out our letter and submit that. You can submit a Congress, and then you can also submit a letter to the agency directly. And we will do follow-ups on the portals to use to make those submissions to the agency. FDA also has an open comment period as a follow-up to the session that they did on menopause and hormone therapy. We are definitely pushing to do a submission ourselves as women's health advocates. And so encourage you to use the portal for that. So we'll follow up with that portal information. But basically, we want to make sure that they're no longer, misinterpreting, misusing the data from the women's health study on the impact of taking hormone therapy and the risk associated with it. What we are seeking is data-based submissions. So if you're a researcher, if you're a clinician, or even if you're a patient, if you're running, menopause organization, what have you, just make sure that we're always citing data for that submission. That is what they are going to be using, not just opinions. So it's super important that we do everything. And everything at Women's Health Advocates is data-backed, evidence-based. We feel very strongly as public health folks, as clinicians, executives, investors, all of us feel very strongly that everything is evidence-backed. Okay, legislation. So did a quick look at legislation that is out there. And just as a refresher, in the month of August, because they're home for recess, they can't introduce any new bills. So there will be a bunch of new bills coming now that they're back. And just took a quick look at, there's some interesting fertility bills, a couple that were dropped right before the recess. There's 5 different menopause bills or resolutions. There's 6 bills on maternal health. There's 7 on breast cancer through the Breast Cancer Early Detection Coalition. We keep lobbying hard on those 7 bills. One in particular, the most important was the Find It Early Act, which is going to be introduced in the House in October during Breast Cancer Awareness Month. And then lastly, the Uterine Fibroid Intervention and Gynecological Health Treatment Act. That was dropped in July and has bipartisan support. it has one Republican senator, Cynthia Loomis of Wyoming. That's the co-sponsor, the Republican co-sponsor. So need to build up more co-sponsors in the Senate. The House one has about 40 co-sponsors. And one of our dedicated advocates, Soteria, leads the Fibroid Foundation. And so we're very supportive of her and her efforts to push this bill. So we're going to be prioritizing that, among others, this fall. Women's health advocates updates. So since we started, we wanted to take a little look at who is in our group. And as you can see from the pie chart, the biggest portion of our membership are actually investors. And next up are entrepreneurs, although fairly close. Then we've got researchers, clinicians, policy experts, marketing, media, PR experts, and those with lived experience. So I love that actually we're pretty well distributed, which is really important to us as an organization, that we have all those voices coming together. So wanted to just share that little tidbit. And then the actions that we've taken since we've started. So over 1,500 letters to Capitol Hill. We've got over 2,000 LinkedIn followers now. Our Instagram account did only get started like 2 months ago, but it's growing. We're in 50 states, as we have been for a while now, 16 countries. And then we've got 60 steering committee members, which is pretty great. So we are growing. Our ask of you is to engage in our What's Your Why campaign. We've talked about this every month when we come together. It's super easy. We're going to be putting all these links we're going to put into the chat box. If my colleague's not doing it now, we will make sure that's in the chat box so you can easily just click. But Vanessa's worked really hard to create this. It's an awesome, super easy to use Canva link. You just pop in your picture, your quote, and then post it. And make sure that when you post it, you're using the hashtag What's Your Why. You are using our handle, Women's Health Advocates, on LinkedIn, and then Women's Health Advocates on Instagram. And just know that every time you speak up and draw attention to this issue, you are empowering others to do the same. Others are going to follow your lead when you do this. So it's like super awesome. And I always feel energized when I see these. So I just really encourage you to engage in this and be part of our What's Your Why campaign. Join the committee. So we've got a few upcoming planning calls with Southern California or Los Angeles area. We've got New York metropolitan region, which is including New Jersey. We've got an endometriosis call. We've had this committee started a few months ago, thanks to Akifa and Nicole, who have really stepped up and provide guidance on some legislative action we can take. So we're working on that. And then the maternal health committee call, that committee is just getting started. So this will be our first kickoff call on September 18th. Join the steering committee. And when you're on the steering committee, you shape the Women's Health Advocates policy work, you speak at events, you access expertise and intel of our lobbying team, who was talking regularly with members of Congress, who was on Capitol Hill regularly. Super interesting things that we find in bills and conversations with members of Congress that we like to share with our steering committee. You also get to join a powerhouse network. These 60 women and men, we have a few men in there, are amazing and super energized around women's health. And I can even see when we do our steering committee calls, the connectivity that's happening. And so we love to facilitate that and help people like grow, soar, rise together through this network. And then exclusive invitations to private events and meetings with members of Congress, agencies, and KOLs. And so all the events that we're doing across the country, which I'm going to talk about in a minute, those are free for steering committee members. We are working on a special dinner with one of the most powerful members of the Senate that is exclusively for steering committee members. So there's lots of benefits to it. And so we'd really love to have more people get on board. And it's easy. Just go to our website, womenshealthadvocates.org, and you can just click the button for join the steering committee. And also you can email me any questions anytime. Come to an event. So we have a bunch of events, super excited. Thanks to Maura and Shruti. We've got an awesome Pittsburgh event coming up this Friday, right before the Women Who Rock concert. Melinda with Women Who Rock has done a great job of promoting us in this event. So we've got a great collaboration with that organization. Our Women's Health Advocates bags and our postcards are getting distributed to tons of people at the event. We've got a VIP table. We're going to be selling our t-shirts, getting people engaged. So really excited about that. Then in San Francisco area, more specifically Los Gatos, we have an event on Sunday afternoon, which is going to be really special. We have amazing speakers, all people I admire and have had the pleasure of working with over the years. We've got experienced investors in women's health, innovations and companies. We've got experienced patient or health equity expert, and then we have longevity and menopause expert. So it'll be really interesting discussion and way to come together and a great fundraiser for what we're trying to do and all our efforts. We've got the Steel and Resolve event that's in Detroit on September 25th. Thanks to Katie Kirsch, she has sponsored that entire event and done a phenomenal job pulling together some real leaders in the area, investors and powerhouse folks. That is an exclusive event for steering committee. And then lastly, we've got our October 2nd Chicago event, and we're super excited that we have this famous actor, Falake, cannot pronounce her last name, but she most recently was in Mufasa, which my kids loved. She played Amara in the movie, and she's done a ton of different things, and she's on Broadway right now. So she's going to be amazing and share her journey, her health journey. And then we've got these other amazing speakers as well. So that is coming together. And then we've got our online congressional briefing happening on September 16th. So please register for that with amazing speakers. Okay, other events coming up. Pittsburgh, Bay Area, we talked about. Online briefing, we talked about. Detroit, Chicago. Then we've got Los Angeles, Boston, Los Angeles again, Phoenix, New York, New Jersey, Philadelphia. So there's a lot going on. We just had our Philadelphia kickoff call yesterday, which was great. Lots of really good ideas. I think we're going to do a breakfast event sometime before the end of the year if folks are interested in that. All right. So what can I do? You're hearing all this information and you want to get active. So please post your what's your why and tag us on LinkedIn and Instagram. Follow us on Instagram. Join a committee. That is where you can have a voice. You can get involved at the regional level or, based on CMS reimbursement, based on endometriosis, based on maternal health. We will start to build up more and more committees over time. But there are lots of ways to get involved in something you really care about. And then obviously the breast cancer early detection is super active, really effective organization that has, many ways to get involved in that as well. Joining the steering committee, coming to an event, we listed all those events, and sending letters. So sending a letter to your member of Congress. And what's really important right now, because they are, as Aditya shared, they are in the midst of doing the House and the Senate health funding bill. Now is a good time to be sending those letters in, to be pushing members to push for higher funding levels and to include these language references around women's health. So we have a sample letter in our online advocacy tool. Just go there, put in your address, the letter will pop up, and personalize it. Please take the time to personalize it. We've heard repeatedly from Hill staff, and as a former staffer myself, I know it makes a huge difference. So please take that time, an extra 2 minutes to say, I'm a doctor, I'm a patient, my mother was impacted by this disease, or, whatever your angle, I'm a researcher, I'm an investor, I'm an executive, like whatever your angle is, trust me, it matters. Being a constituent is super, super impactful. So take that time to personalize it and then use the rest of the letter and click send, and it's done. It's like, it literally takes a few minutes, maybe a couple more minutes if you personalize. So definitely do those letters. The appropriations one is a big priority. The second one is the CMS reimbursement one, which we put in today. We really want to put pressure on members of Congress to contact CMS and then to do their own legislative action on the Hill. So that letter is outlined for you there. Please, again, take the time to personalize. And then FDA. So menopause, we want to make sure that they are using data and evidence in making this determination on removing that black label for hormone therapy, so that women are getting access to this, because it makes a huge difference just in managing hot flashes, brain fog, what have you, but literally like heart health, like Alzheimer's, all these really serious chronic conditions are tied to access to hormone therapy. So it's really important that we are submitting comments through that portal. So we will follow up with the portal that you're supposed to be using for these submissions to the agencies. So those are things that you can do to be active. And I think I did leave enough time for questions. So welcome questions from folks. And Vanessa, I appreciate your help in managing those questions, letting me know questions to answer. Can use the Q&A box, which is blank right now. So let us know questions.
Yeah, so I think we have a lot of people, hi everyone, that we're putting questions in the actual chat and not in the Q&A. So we'll just say for next time, if you put them in the Q&A, it's easier for us because we can see it. We will have the chat so that we can look at the chat after the meeting. But one of the things that I just wanted to mention regarding, I see a lot of people putting different events that are happening in their local areas. And that's one thing that we also want to highlight. So if there's an event that's happening in your local area around women's health, certainly tag us in it, and we'll be happy to amplify that. We won't necessarily be able to see everything that happens in a chat, so we want to make sure that we're amplifying those things. And if you have a specific question that didn't get answered today or that pops up later on, you can email us at info@womenshealthadvocates.org, and we can then put that. Oh, I think we have a couple more questions, which I love. We can then add that to our next meeting. Any thoughts on how the Rural Health Transformation Fund may impact women's health initiatives?
You know, it's interesting you should say that topic or that fund, because we are actually working with Healthy Woman, which is, on our steering committee, and great organization focused on women 35 plus. We are working with them on a online congressional briefing on the topic of rural women's health. And so I think that's a great question. So anyway, stay tuned for that. Just a little plug for that. But so, a lot of these changes that are in the Big Beautiful Bill, they aren't going to happen for a while. So we'll have to see the impact. But I think this community needs to emphasize, over 1,000 counties are complete deserts when it comes to maternal health access. So, we have to point out that we have to close these gaps using these funds. I think that's really important, but we're not going to see any dollars going out until it goes into effect. And then the states have to apply to CMS to use 50% of the funds to get access to those additional 50% of the 50 billion. So, it'll be up to the state. So that'll really be the governors and the politics of that, if they want to engage or not. So I think that there's a lot. We have to just see how that unfolds for how that impacts women's health.
Yeah, thank you. Another, and this is not a silly question. There are no silly questions. Why what? I have a lot of whys. I have a lot of whys too. And so, I will say that I've seen some people, Liz Powell, post more than one why. And
yes, I have. Yeah.
You can too, because my why might be different. My why is different every day. So, your why is whatever you want it to be. I mean, maybe it's personal. Maybe it's something that's happening you see in your local community. Maybe it's because you have daughters or because you've experienced, a lack of care. If you're a gentle person or man or someone who doesn't identify as a woman on this call, welcome. And your why matters too. And so all of the whys are really important. There are some questions in the chat around getting more information on different events, like the Boston event and some other events. We encourage you to go to our website, and all of the events are listed on the website. And if you have additional questions after reading the information on the website, certainly reach out to info@womenshealthadvocates.org if you have questions about a specific event. But on the website, there's information about each event, and if there is a registration needed for that event, there's a link to register for each event. Will Liz's slides be available? We will send a follow-up email with a good portion of all of the information that was in this in that email. We always send a follow-up email, so you will have access to all of the information. If there's something very specific, Gerald, that you're looking for that you want to utilize, certainly reach out, and we're happy to work with you on that. I think that those are all the questions I see, and we have like 1 minute left. I will say that in addition to your whys, if anyone is so inclined to share a video, a little selfie of yourself talking about why these things are important to you, I encourage you to check out one of our leaders, Sally Wolf. She does a great job sharing videos, and they can be, really quick, but videos do really well on LinkedIn and also on Instagram, and certainly tag us and we will share those.
Dr. Bio does as well. She's
Dr. Bio,
phenomenal with that.
especially on Instagram for Dr. Bio. So certainly if you feel comfortable sharing a video, we encourage you to do that as well.
All right, I'm hoping to see people in Pittsburgh, Bay Area, Detroit, Chicago, Los Angeles. I'm hoping to see you guys very soon. I'm really excited. Every time we do these events, it is so energizing. It gets me so pumped up. So I really hope I get to see you soon. Thank you all for dialing in. And we are off to our steering committee call. Steering committee folks, you should have the link, but text me if you don't. All righty. Thank you so much.
Thanks,
Bye.
everyone.